Hello. Let's talk about postmortems. A few days ago I posted something, a question on postmortems, just to see what you've heard or know about postmortem. And we got quite a number of very interesting responses, and some of you may have seen some of the responses. But let's dive straight into the matter. First of all, let's define what a postmortem is. So, what is a postmortem? A postmortem is a medical examination that is conducted on a dead body to establish the cause of death. It is conducted by a pathologist. Now, a pathologist is a specialized type of doctor who specializes in the nature and cause of disease. And so this is the group of people that do this type of examination. Now you may ask, when is a postmortem necessary? At what point does a postmortem arise? A postmortem can be asked for by the coroner. Now the coroner is an officer of the court, is an independent officer of the court, whose main interest is to investigate deaths that are sudden, violent, or deaths that are involved in, that are a matter of criminal acts. And it is very necessary that deaths of that nature are investigated by the coroner. And usually the findings, when the coroner is involved, those findings are usually used either in an inquest or maybe it's a matter that may arise in court. Another times that a postmortem may be necessary is when the doctor who is attending to the patient or who was attending to that patient requests for a postmortem. Now, you may ask or you may wonder, what happens during a postmortem? What happens during the postmortem is that a pathologist who is a doctor, who is trained and specialized in the nature and cause of disease, will cut open the body, will take samples, fluid samples, will take either a piece of an organ or an entire organ for testing. Now, some of you may have apprehensions that maybe the body is mutilated and all that. Actually, you will be surprised that the body during a postmortem is treated with utmost respect. The body is handled with a lot of care and respect. You don't lose your respect just because you're dead. And so, when those samples are taken, they will carry out a number of tests. Now, on the part of doctors, I've told you why a coroner would ask for a postmortem and what a coroner is. On the part of doctors, the reason we do postmortems is, number one, either that we were treating a patient, the patient died, we're not sure what killed the patient, or that the patient that we were treating, we knew what the cause was. We knew the disease, but we would like to have more understanding of that disease. And that happens quite a lot. Sometimes a disease may present in a manner that we've never seen before, or that a disease may progress in a manner faster than we've seen before. So we'd like to understand fully. The reason we do that is because once we gather that body of knowledge, we will then approach the next case better. Part of the reason you are treated with that much success, and part of the reason you got the hospital and you benefit from the knowledge that these doctors have, or that we have as doctors, is because there were postmortems that were done in the past. Because of those postmortems that were done in the past, we are now able to treat you better. So next time you hear the doctors are asking for a postmortem, don't hesitate. Just let them do their job. It may help the next person who's coming. But even you as relatives, in cases where the cause is not very clear, one of the things you'll find is that postmortems help in terms of finding closure. It's very difficult to find closure as a relative if you're not sure what took your loved one or how your loved one died. So a postmortem is one of those ways that you would be able to benefit by finding closure. But another way is that you are helping the next person. Yes, sadly you've lost a loved one, but you are also helping others who may be in the same situation. So don't shy away from postmortems when they are asked for. So, will your permission be asked for as next of kin for a postmortem to be done? Yes and no. Yes and no in the sense that if it is the coroner who is asking or who is doing the postmortem, your permission is not needed. Because that's usually a matter of, criminal investigation, or it's a matter of where someone died suddenly, or someone died in a very violent manner. So the coroner may not ask for your permission. But for us doctors, we will always ask for your permission. And your permission, your consent is necessary. It's a requirement that before we conduct a postmortem, if it's a doctor who is asking for it, that you, as next of kin, you need to sign the consent. Now, consent is not just about you signing off. Consent demands that the doctor who's conducting or the doctor who's requesting for the postmortem explains to you clearly why they want to do the postmortem and explains to you what the postmortem is, and you also demonstrate that you've actually understood what the doctor is talking about. Then they'll go ahead and do the postmortem. Do postmortems delay funerals? Not necessarily. In fact, postmortems do not delay funerals at all, unless it's a case where you find that the matter is of a criminal nature. The coroner may require that they take a bit of time, but generally speaking, a postmortem should not delay a funeral. And I have not seen many cases where a funeral has been delayed. Do results take time? Some of them do, depending on the type of tests that are being done. Some results may take a bit of time before we can conclusively say this was the cause of death. Now, in reading some of the comments that were on the page, for example, there are others who believed that during a postmortem, brains are removed to go and make Panadol. No such things happen. Human brains are not part of the ingredients for making Panadol. I thought I should clear that. And there are quite a few other issues that came up as well. A postmortem, for example, is not conducted by a mortuary attendant. A postmortem is conducted by a pathologist who is a doctor who has specialized in the nature and cause of disease. With that said, for prosperous and healthy citizens, Dr. Njajati signing off. So if you have any more questions, comments, let's hear them. Thank you very much.